Welcome to Nourish MD, Doctor-Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hi, and welcome to Nourish MD, the podcast where we learn, grow, and nourish our health together. Hi, everyone. I'm Meg Tancredi, your host and registered dietitian for today. Today, we're talking about blood sugar. Blood sugar is something that matters for everybody, not just if you happen to have type 2 diabetes. So, blood sugar impacts our mood, our energy level, blood vessels, other issues going on in our body. Everything from head to toe is blood sugar related. So I'm really happy that you are here joining us today. And let's go ahead and get started. I want to start by talking about what unstable blood sugar feels like and looks like, because most people actually experience this fairly regularly. So blood sugar, when it's not optimized, can cause that shakiness. You can have hangry feelings going on. Maybe you have some cravings. You're not thinking as clearly. We call that brain fog. You're not able to concentrate, focus as well as you would like. And that just doesn't feel good. That's not the way we want to be living day to day. We want to feel great. We want to feel happy. We want to feel resilient with what comes our way. And so blood sugar is really important. It's one of those fundamental topics that we should all understand and manage it ourselves as best we can. And so when we have that unstable blood sugar and those symptoms, those unwanted symptoms, they come from these highs and these lows. Blood sugar naturally rises and it naturally falls. But when we have a rise that goes a little too high or a dip that goes a little too low, we call this glycemic variability. How often are those rises and those big falls happening throughout the day? We want to make sure we don't have a high glycemic variability, because that in of itself is what drives oxidative stress, inflammation, that fatigue, mood changes, these things that we don't want to have. So if that's what you are feeling day to day, this podcast is definitely something that you want to pay attention to. When blood sugar spikes too quickly, or rather when it just spikes quickly, we have insulin that comes to its rescue, right? To bring that blood sugar back down. When that happens, cortisol, which is our stress hormone, that jumps in to correct it. And then over time, this is actually a bit of a roller coaster for your body. And that is what leads to all of these health issues. So you can have, hormonal imbalances going on. You can have blood sugar dips at 2 a.m. that cause you to wake up going, why am I awake? It can promote fat storage, because when we have higher insulin in the blood, that's what's going on there. When we have these chronically elevated blood sugar spikes, and then they come back down very quickly, that can actually drive cravings. It can drive you to overeat maybe the foods we don't want to overeat. So there's also, a lot of wear and tear on our cells and our blood vessels. So think about like eye health. Think about all the blood vessels that we have in our body. We want to preserve them. We want them to not break down. They have so many functions. And so when we have chronically elevated blood sugar, we're causing our blood vessels to be damaged a little bit each time. When we have that chronically elevated blood sugar, we become more insulin resistant. We might develop a greater risk for fatty liver disease, high blood pressure, high triglycerides. nerve and blood vessel damage. Of course, I just said cognitive decline and just faster biological aging. So we get our labs done, right? Maybe once a year at our physical, maybe a couple times a year. And usually when it comes to blood sugar, we'll have our hemoglobin A1C measured in addition to our fasting glucose in the morning. And those are important markers. So your hemoglobin A1C is roughly a 3-month average of how your blood sugar is looking in your body. Red blood cells have an average lifespan of 3 months, and sugar attaches to that red blood cell. It's called glycation. So we check our levels A1C, and then we also check the fasting glucose. And remember, these are one point in time. So when it comes to labs, like your A1C, we want to look at what does the overall trend show us. So is your A1C is it going up? Is it staying the same or going down? Hopefully it's going down, or it's staying the same if it's at an optimal level already. So the problem is that it's not showing us what is going on a day-to-day basis. It's not showing us, what is causing my blood sugar to go higher than we want it to be? What is causing me to wake up in the middle of the night? Why do I feel so tired around 3 p.m. every day? So traditional labs are important. Having the data that shows us what's going on in our bodies day to day, hour by hour, minute by minute, is going to be the ticket to optimizing blood sugar control. So glucose responses, they're highly individualized. So I might eat the same meal as someone else, and my blood sugar will probably respond differently than that person. And that's because blood sugar is influenced by so many different things that go beyond just what's on your plate. Blood sugar is influenced by stress responses, how well you slept last night, what's been your physical activity, what's your meal timing like, genetics, what's your gut microbiome looking like these days. There's so many different reasons as to why your blood sugar responds differently than other people's. And so this is why a one-size-fits-all nutrition plan just doesn't work. So a lot of times people will say, I just have to cut out carbohydrates. I will never tell you to do that, because we don't want to cut out one group of food. We don't. They all serve their purpose. And so when we start using a CGM, which is a continuous glucose monitor that attaches to the back of your arm, I promise, painless, I promise, that CGM, that monitor, will show you in real time what is going on in your body. This gives us such good insight. It shows you what is causing your blood sugar to stay high. What is the effect of certain exercises, whether it's a vigorous exercise session or something more gentle like yoga or Pilates? We see how your blood sugar responds to that. You can see what your own personal food triggers might be. You can also see, hey, man, I really should prioritize sleep, because when I do sleep well, my blood sugar is very, very much handled well. So what's going on there? So it can kind of help you see what is happening, what you need to prioritize. And it's also a little bit of a motivator.
Transform your health with PPMA's personalized support from our expert registered dietitian. Get the clarity, confidence, and tools you need to feel your best. Visit privatemds.com to get started today.
So you don't need to have really strict, restrictive food guidelines. You just need to have strategic habits that support your physiology. And so science-backed strategies, as simple as these are, include eating protein and fiber first. We always want to make sure we have protein on our plate and we have fiber in the form of plants on our plate. Remember, we always want to have colorful variety of plants on our plate. We can implement 10-minute walks after meals. So sometimes I will talk with, most often I will talk with people about, hey, let's start with getting in that walk after dinner, especially that evening meal. We're less insulin sensitive in the evening than we are in the daytime. That 10-minute walk can reduce glucose by up to 30%, which is a really big deal. Another science-backed strategy we try to work on is having a 10 to 12 hour eating window. So what does that look like? Let's say you stop your last bite at 7 o'clock. You have dinner at 6. You enjoy your meal. You take your time. And let's say by 7 o'clock, you are finished. Well, when you go to bed and you sleep overnight and you wake up, it's probably going to be another 12 hours before you have your first bite of breakfast. So if you finish at 7 p.m. and then you don't have your first bite until 7 a.m., that's 12 hours. And so you just accomplished that. Most people can do a 12-hour fast and a 12-hour eating window. The other thing is that we want to make sure we dial in our sleep quality, because one poor night of sleep can reduce insulin sensitivity up to 25%, which is a really big deal. So these shifts, they can be very simple. We start one at a time. And as we start to implement each strategy, we can see improvements in how our blood sugar is responding, which is fantastic. So I've talked a little bit about insulin sensitivity. We want to go for this. This is one of the big goals, right? When we improve insulin sensitivity, we have healthier blood vessels, we lower inflammation and that oxidative stress. Our brain is so much happier, it functions a lot better. Weight management becomes a little bit less challenging, and we're feeling that steadier energy and mood. Overall, we have slower biological aging. This is a really big deal. So the fact that blood sugar ties into all of these components and we can manage it through very simple steps, hey, why not? So here's the thing. When you have data from that CGM, from that monitor, you have the interpretation, the support, and the accountability combined. And this is what leads to better habits, better metabolic markers, and just better long-term outcomes. So you have the real-time data. You've got someone in your corner helping you interpret it, helping you strategize about, hey, what are a couple of things that I can shift in my day-to-day life that can help promote better blood sugar. And this combination is exactly why we created the Blood Sugar Bootcamp. I'm very excited about this. So with the Blood Sugar Bootcamp, it is designed to help you understand your numbers in very simple, supported, personalized ways. So you will have your own monitor. You'll have a weekly data review. You'll have me there to help, make it approachable. Sometimes it can seem overwhelming, especially if something's new. And not to worry, I am there to help you and to clarify things. And we will work together to come up with a plan that works for you. I never want anyone to feel overwhelmed, because making changes in our health can feel overwhelming. And so when you have the right people in your corner and the information in front of you, it can be a little less daunting. The caveat is that we have limited spaces. So I really encourage you to call as soon as you can. there are going to be 4 specific dates that we will be working together, because on visit 1 is when you'll have the CGM. And then 1 week later, we will meet. So we'll meet consecutive 4 weeks in a row, and we will go over what that information is, how to adjust, what's going on, any questions you have. There are specific dates. So January 15th, January 21 or 22nd, and then January 29th, and then February 4th and 5th. So these are on purpose because it syncs with the CGM timeline. And so hopefully that will work with your schedule. So please give us a call today. I would be honored to work with you. And just remember, it doesn't matter what our age is. It doesn't matter where we're starting or what our previous experience is. We can improve our health at any time. You just need simple strategies that work with your lifestyle, and you're going to be set. So I encourage you to give the office a call, and let's get started together. I so look forward to working with you. And thank you for joining us today on Nourish MD. Please remember to like and follow us on Spotify and Apple Podcasts. All right. See you next time. Bye.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.